Poverty. Maybe you picture hungry people, homelessness, empty pockets, dirtiness, lice, hunger. It's impossible to choose just one face from the nearly 50 million Americans living in poverty. You're probably thinking that's a ridiculous number. Almost 7% living in poverty? That's insane. But you'd have to know what constitutes poverty. Poverty is not just an economic issue. It also has social aspects that should be measured for each household, considering income and savings, including near cash and in-kind benefit, non-discretionary expenses, household composition, geographic location, physical and mental health, changing standard of living, changing cost of living, age, and depth of poverty. There are two main approaches to defining poverty. There's policy and descriptive. The descriptive method is all about acknowledging deprivation. Step 1, determine the means that people do and do not have. Step 2, if we had all the resources we needed, what would we do to help these people? Step 3, determine the actual policy choices that are in line with the means we have. A policy approach is based on identifying the focus of public action. The steps are reversed in this case. First, making the policy, and then defining poverty as to how the policy will be able to help them. Poverty should be defined by what people do not have, not by what's easiest to measure or what the government can afford to do to help.
Most people might think the obvious answer is money. If you don't have any money, you can't pay for food, or clothes, or shelter, or medical expenses, really for anything. If you have no money, you're clearly poor. This approach focuses on economic poverty. What if two people make the same amount of money, and therefore have identical incomes? But George lost part of his leg while Bob is completely healthy. Has to deal with medical expenses. This seriously dips into the money he could otherwise be spending on food and shelter. And Bob spends almost nothing on medical cost. Is George poorer than Bob? According to the income approach.
Social poverty, on the other hand, focuses a little less on money and a little more on a thing called social inclusion, or being able to actively participate in society. Adam Smith, a big-time philosopher and economist of the Enlightenment era, held that being poor meant not having what was needed to be a credible member of society. Martha Nussbaum's approach on this whole poverty deal. She's a real fan of capabilities. If you were to ask her what are capabilities, she would respond by saying they are sets of possible functioning. A functioning is what a person can actively do. Let's talk to the hand.
Nussbaum believes that humanity should share a goal for everyone to obtain at least a threshold level of the combined capabilities of life, bodily health, bodily integrity, senses, imagination and thought, emotions, practical reason, affiliation, interactions with other species, play and leisure, and control over one's political and material environment.
Allowing a human a certain level of each one of these is how Nussbaum defines treating people with equal respect. Limits on any of these capabilities greatly limits people's functionings. She believes that a nation cannot satisfy the need for one capability by giving people a large amount of another, or even by giving them money. All are distinctive and need to be secured and protected in distinctive ways. But that's Nussbaum's list. You may agree on what she defines as essential capabilities, or you may not. That doesn't change the fact that capabilities are all about choices. They represent what each person could possibly choose to do. So you're in poverty if you do not have the choice to do certain basic things, rather than defining poverty by what people buy, which could get tricky, since some people might choose to or not to spend their money on certain things.
We believe that the poverty measure should consider household income and savings, including near cash and in-kind benefits, geographic location, non-discretionary expenses, household composition, physical and mental health, changing cost of living, changing standard of living, and depth of poverty. Household income and savings. Money matters. The only way to see a complete picture of a household's finance is by including earnings, savings, social security, public assistance, child support, supplemental security income, food stamp value, tax liability, and earned income tax credit. We also think it should account for in-kind and near-cash benefits like SNAP, WIC, and payroll taxes, so that a person getting food stamps, although it would be a swipe card nowadays, would not be on the same poverty level as someone without that extra government aid when it comes to buying food. Non-discretionary expenses. Keeping a job costs money. Just think of the transportation, and for working parents, the rising cost of childcare. Since spending this kind of cash is necessary to make money in the first place, these mandatory expenses must be considered. Household composition. Members of a household pool their resources. The number of contributors and dependents sharing these resources matters. Legally defining a family can get messy. Easy to use the legally related, such as by blood or by marriage, But then there are foster children and cohabitating unmarried couples and friends living together. And just how do you classify your mom's Uncle Alan who moved in last month? So we prefer to measure poverty using households rather than families as a unit of analysis. Because, as said by Mayer, poverty is closely tied to the education and employment levels of the primary person in the unit. Think the amount of education the head or heads of a household have received is important. It is much harder to provide for yourself and the household with insufficient education because most well-paying jobs require higher education. Physical and mental health and age. This has to do primarily with medical costs, but there's more to it than just that. We believe that age is more than just a number that polite people try to avoid referencing. Sen said that sometimes the same handicaps, such as age or disability or illness, that reduce one's ability to earn income can also make it harder to convert income into capability. For example, older people, because of their age, cannot work, but those years also give them higher medical costs, including a greater susceptibility to illness and difficulty achieving mobility that can bar their obtaining of the bare necessities. Poverty measures should adjust with the changes in the cost of living. Gallons of gas, hamburgers, clothing, almost everything is more expensive than it used to be. Mortgage interest rates fluctuate, as do real estate prices. We should use the CPI, or the Consumer Price Index, and interest rates as a factor in determining poverty. Changing standard of living. More things become basic necessities as humanity progresses. Adjusting the definition of poverty based on changing standards of living is called a relative measure. A relative measure, which is commonly used in Europe, holds that people are poor if their society considers them to be poor. In contrast, an absolute measure has a consistent list of bare necessities that one would need to live a sufficient life without updating it as time progresses, and considers anyone without those things poor. Then there's depth of poverty. Only having two distinctions, with someone either being poor or not poor, is impractical. Someone who's $1 above the poverty threshold, or the line that measures poverty, is considered to be not in poverty, while someone who is $1 below the poverty threshold is poor. This $2 difference doesn't accurately reflect who is or isn't poor, and someone who's $1 below the poverty threshold is in the same boat as someone thousands of dollars below him or her just by this two-dimensional standard. It's obvious that many more than just two financial situations exist. It's not just poor and not poor. We understand that such a line needs to exist. That's how we are able to make distinctions. However, we believe that the depth of poverty, in other words, how close to the line a household is, must be considered in order to gauge the true situations of the households in the nation. Geographic location. Living in New York City would cost way more than it would residing in Ponchatoula, Louisiana, meaning a $40,000 salary wouldn't go as far in New York as Louisiana. It's important that poverty measures take this into consideration.
Because I'm going to start throwing some letters at you. First, the O, P, M. The official poverty measure. Once upon a time, Molly Orshansky of the Social Security Administration, the S, A, saw that the modest families spent about 1/3 of their income on food. Orshansky took the USDA's, United States Department of Agriculture, Economy Food Plan, or Lowest Food Cost Plan, and multiplied it by 3 to set the United States' official poverty threshold, or the FPT model, called the Economy Food Plan. Each year since its 1969 debut, the OPM adjusted for the cost of living thanks to the CPI, the Consumer Price Index. Threshold was adjusted for family size, composition, and the age of the householder. OPM is still out of date. Now food is cheap, so now only about 1/6 or 1/10 of a family's expenses is on food and legal marriage. Geographical differences in pricing, non-discretionary expenses, medical costs, and the changing standard of living are not accounted for in the OPM. But as economist John Iceland has pointed out, thanks to the OPM being an absolute measure, it has achieved a level of consensus that no other measure in the United States can claim. And here's another system with a few more letters. The SPM, or the Standard Poverty Measure, is conducted by the National Research Council of the National Academy of Science, or the NAS. The NAS partly came up with the SPM to see if the government programs were working. The SPM does account for a lot of what the OPM missed, but unlike the OPM, the SPM does not adjust its poverty threshold for the age of the householder. We think that poverty should be measured by capabilities, which are the sets of possible functionings. They are the things that a person has the opportunity to do. All central capabilities, from nourishment to education to control over one's environment, can be bought with money. The OPM and the SPM measure that. We don't just want to consider the money aspect. We want to look at health, geographic location, proximity to community programs, age, gender. Education, these are aspects of a household that determines what it can spend its money on. Gathering all of this information would be difficult. And yes, counting all of these factors while measuring poverty might lead to statistics with higher percentages. But please understand that there's no automatic jump from our measuring of poverty to the government. And ways to address poverty? Well, that would take an entirely different video. Right now, we're just looking at measurement, and we believe that people's choices, or lack of them, matter. Because to us, leading a dignified life is not the same thing as solely existing.